Older adulthood doesn't have to mean living in fear of falling. Yet nearly every older adult experiences balance challenges, and in most cases, they stem from avoidable habits or oversights. By recognizing and correcting these 5 common mistakes, you can reclaim stability, confidence, and independence in your golden years. Before we start, I'd appreciate it if you could like this video. Your support helps me continue sharing helpful insights for better aging. If you haven't already subscribed, I recommend you do so, and turn on notification bell so you never miss a video. And if you find this video helpful, please comment number 1 below to let me know. If not, leave number 0 and let me know what you'd like me to improve. Now, let's get started. 1. Skipping strength and balance exercises. As we age, muscle mass and bone density decline naturally, a process called sarcopenia. Without targeted exercises, the muscles that support posture, joint stability, and reflex responses weaken, making everyday movements riskier. When strength and balance workouts are neglected, muscle atrophy accelerates. After age 50, adults may lose up to 1 to 2% of muscle mass per year if inactive. Proprioception suffers. The body's awareness of position in space deteriorates, increasing missteps. Reaction times slow. Weaker support muscles struggle to correct a stumble before gravity takes hold. How to avoid this mistake? Incorporate resistance training 2 to 3 times a week. Use light dumbbells, resistance bands, or bodyweight exercises. Think squats, wall push-ups, and seated leg lifts. Aim for 2 to 3 sets of 8 to 12 repetitions per major muscle group. Practice balance drills daily. Single leg stands. Hold onto a chair back, lift 1 foot slightly, and hold for 20 to 30 seconds. Switch sides. Heel to toe walks. Walk in a straight line, placing the heel of 1 foot directly in front of the toes of the other. Embrace low-impact classes. Tai Chi. Research shows regular practice improves postural control and reduces fall rates in seniors. Chair yoga builds core strength and flexibility in a supportive position. Set realistic goals. Start with 5 to 10 minutes per session and gradually increase duration and difficulty. Consider working with a certified trainer or physical therapist for personalized guidance. By committing just 15 to 20 minutes per day to targeted exercises, you'll notice firmer legs, steadier hips, and quicker reflexes, key defenses against loss of balance. 2. Wearing the wrong footwear. Shoes are your foundation. Ill-fitting, slippery, or overly flexible footwear can sabotage balance, turning a simple walk into a hazard. Common missteps include flimsy soles. Thin, worn-out soles offer little shock absorption and poor traction. Loose slippers or socks. Slipping inside soft, unfitted shoes leaves toes and ankles unprotected. High heels or pointed toes. These shift weight unnaturally forward, straining ankles and reducing stability. How to avoid this mistake? Choose stable, supportive shoes. Look for a firm heel counter, the shoe's back, and cushioned midsole. Opt for a sole with shallow treads, enough grip without tripping hazards. Ensure a proper fit. Shop later in the day when feet are slightly swollen to get an accurate size. Leave about a thumbnail's width between your longest toe and the shoe's end. Prioritize non-slip technology. Many brands offer rubber outsoles with multi-directional tread patterns. Avoid smooth leather soles or glossy bottoms. Invest in orthotic inserts if needed. Custom or over-the-counter inserts can correct foot alignment and distribute pressure evenly. They're especially helpful if you suffer from plantar fasciitis or flat feet. Discard old shoes. Replace footwear every 6 to 12 months, or sooner if tread wear is visible. Test by looking at sole depth and by bending. If the sole creases at the ball of the foot, it's time for a new pair. A sturdy shoe can mean the difference between catching yourself after a slip and tumbling to the ground. 3. Overlooking home hazards and poor environment. Your environment plays a pivotal role in balance safety. Even the steadiest individual can falter on an uneven rug or in dim lighting. Key oversights include cluttered pathways. Stacks of magazines, electrical cords, and loose items block clear walking routes. Dim or flickering lights. Shadows distort depth perception, causing misjudgment of stairs or thresholds. Unsecured rugs and mats. Small rugs without non-skid backing can bunch or slide underfoot. Absence of support aids. No grab bars in bathrooms or handrails along staircases increases risk. How to avoid this mistake? Declutter walking areas. Keep hallways, stairs, and rooms free of unnecessary furniture or decor. Coil cords along walls or secure them under carpets with tape. Enhance lighting. Install bright LED bulbs, at least 800 lumens, in hallways, bathrooms, and stairwells. Use motion sensor night lights to illuminate nighttime trips to the bathroom. Secure floor coverings. Attach rubber non-skid pads under small rugs or remove them entirely. Choose carpets with a low pile to minimize trips. Install support installations. Place grab bars beside toilets and in showers at a comfortable reach. Ensure staircases have handrails on both sides, firmly anchored into studs. Consider a home safety assessment. Occupational therapists can evaluate your living space and recommend customized modifications. Many senior services and community health organizations offer free or low-cost assessments. By proactively fall-proofing your home, you create a supportive backdrop that bolsters your muscle and balance efforts, helping you stay on your feet. 4. Ignoring medication side effects. Medications can be a double-edged sword. While essential for managing chronic conditions, certain prescriptions and combinations can trigger dizziness, low blood pressure, or sedation, silent culprits behind unsteady steps. Common offenders include antihypertensives. Sudden drops in blood pressure can cause lightheadedness upon standing, orthostatic hypertension. Sedatives and sleep aids. Drugs like benzodiazepines slow reaction times and impair coordination. Antidepressants. Some classes can contribute to dizziness or blurred vision. Diuretics. Excessive fluid loss may lead to dehydration, affecting muscle function and blood volume. How to avoid this mistake? Keep an up-to-date medication list. Note all prescriptions, over-the-counter drugs, and supplements. Update the list whenever doses change or new items are added. Schedule regular medical reviews. At least twice a year, sit down with your physician or pharmacist to assess each medication's necessity and side effect profile. Ask specifically about balance, dizziness, or any new symptoms since starting a drug. Monitor your body's responses. Use a journal to record any episodes of lightheadedness, confusion, or fatigue. Share these notes with your healthcare provider. Adjust dosing or timing. Some blood pressure medications can be taken at night to reduce daytime hypertension. Splitting doses into smaller amounts can maintain steadier blood levels. Discuss alternatives. If a medication poses too great a balance risk, ask about safer substitutes or non-drug therapies. For instance, lifestyle interventions like dietary changes or physical therapy may complement or replace certain prescriptions. 5. Neglecting vision and hearing health. Balance is a multisensory task. Visual input guides where we place our feet, while our vestibular system, inner ear, detects shifts in position. When sight or hearing declines, these vital cues degrade, leaving you more vulnerable to stumbles. Overlooked pitfalls include uncorrected vision issues. Cataracts, glaucoma, and macular degeneration blur depth perception, making steps and curbs hard to judge. Outdated prescriptions. Wearing glasses or contacts with the wrong prescription forces extra squinting and head tilting. Untreated hearing loss. The inner ear house's balance organs. Untreated infections or permanent loss can disrupt equilibrium. Ignoring earwax buildup. Excessive cerumen can muffle spatial signals necessary for orientation. How to avoid this mistake? Book annual eye exams. Catch and treat cataracts early to prevent glare and halo effects around lights. Update prescriptions promptly. Don't make do with old glasses. Adopt vision-enhancing strategies. Use contrasting colors on stairs, e.g. bright tape on edges, to improve visibility. Add glare-reducing window films in sunlit rooms. Schedule regular hearing checks. Adults over 65 should have their hearing tested every 1 to 2 years. Early detection of vestibular disorders, e.g. benign paroxysmal positional vertigo, can lead to simple, effective treatments. Maintain ear hygiene safely. Avoid cotton swabs. Seek professional removal of stubborn earwax. Keep ears dry to prevent infection, especially after swimming or showering. Leverage assistive devices if needed. Invest in high-contrast reading glasses, large face clocks, and amplified phones to reduce strain. Use hearing aids with directional microphones to sharpen spatial awareness. By tuning into your senses, upgrading eyewear, treating ear issues, and adapting your environment, you reinforce the body's natural balance network and stay steadier on your feet. Balance loss in older adults rarely strikes without warning. It's often the cumulative effect of overlooked habits. By integrating strength and balance exercises, choosing proper footwear, fall-proofing your home, monitoring medications, and maintaining sensory health, you tackle the root causes head-on. These 5 mistakes are fully within your control. Correct them today, and you'll stand taller, walk with greater confidence, and preserve your independence for years to come. Remember, small, consistent adjustments yield profound gains in stability and quality of life. Start now and take each step firmly into a safer, more empowered future.